A nursing home and rehabilitation center off North Main Street in High Point was recently turned into a facility to care for COVID-19 patients exclusively. Now, at first, many saw the move as controversial.
But all along, leaders maintained this was a good move to protect people in our state from the spread of the coronavirus. Fox 8's Danielle Jackson joins us live now from Pruitt Health. Danielle, how are staff members handling the current situation since we last checked in?
Neil and Katie, it's been a little over a month since this facility turned into a space solely dedicated to COVID-19, and I spoke with the area president of Pruitt Health and vice president of Pruitt Health, and he told me that they've brought in additional staff to help get the job done and to reduce the spread.
Within the Pruitt Health High Point facility, we have served 46 residents.
Behind these walls are sick patients waiting to get better as they fight COVID-19. Curtis Jones serves as the area vice president for the coast of North Carolina, Pruitt Health. He told us over a video call how they transformed the facility to specifically help people fighting with the virus.
We placed decontamination rooms, which included us placing stark walls within the center, and we also have placed a smart air system.
So far, they successfully discharged 21 patients and are currently treating 26. They've brought in additional staff to help during this pandemic, and they say they have enough PPE to help with the possible second wave of the virus. And they're testing staff members monthly.
We've made sure that the staff have the appropriate PPE within the center, and we've I think based upon the results and all negative testing, we're doing a really good job at it within the center.
Back in May, Pruitt Health High Point received some criticism from family members of patients when they decided to only treat those with COVID-19. We asked if there was a financial incentive involved in making the decision.
There was no push. The main reason that we did this unit was to better provide a service to the local community.
Due to COVID-19 restrictions, loved ones aren't allowed to visit, but they are finding other ways.
They come in and are able to come up to the windows to see their loved ones within the center. So it's really been a remarkable experience.
Now, I asked if they've treated more elderly patients than younger ones and was told people of varying ages have been treated here. Now, right now, they are not sure when they will turn back into a nursing home facility. They tell me they will continue to monitor the COVID-19 trends. Live tonight in High Point, Danielle Jackson, Fox 8 News.